Hello, I'm Dr. Greg Malone from Brisbane Urology Clinic. For part 2 of our Trending in Urology series, I would like to review erectile dysfunction, impotence, or ED for short. Millions of men experience ED globally, which is best described as the persistent inability to achieve or maintain an erection firm enough to have sexual intercourse. As you would know, ED is often a taboo subject for men, limiting your patient's intimacy, affecting their self-esteem, and impacting on their relationship with their partner. Clinical studies have shown 1 in 5 men over the age of 40 suffer from erectile dysfunction. In my experience, finding a satisfying treatment for ED can be a life-changing event for many men and their partners who may have struggled for years with a condition that can impact on their self-esteem and affect their most intimate relationship. The good news for your patients suffering from ED is that there is a growing awareness and acceptance of this as a treatable condition. Fortunately, there are multiple ways and more therapeutic options for ED than ever before to restore your patient's erectile dysfunction over time. Nearly every case is treatable, but only if the patient is aware of the full range of treatment options available to fix his erectile dysfunction. There are many possible causes for ED, both physical and psychological. Diabetes, cardiovascular problems including heart disease, prostate surgery and medications for other conditions are among the common causes we identify. Some of the main early warning symptoms to be aware of in your patients are if your patient mentions a significant increase in the amount of time it takes to achieve an erection, their difficulty maintaining an erection long enough for intercourse, and a decrease in the frequency of spontaneous erections or early morning erections. There is a strong connection between ED and diabetes. Half of men with diabetes have sexual dysfunction caused by diabetes. Men with diabetes are 3 times more likely to experience ED than men without it. And sadly, it can affect these men 10 to 15 years earlier than normal patients. In modern urological practice, one of the more common groups of patients who undergo more advanced treatments for ED are those men who have undergone radical therapy for prostate cancer. Often these men are younger, with previously normal sexual relationships with their partner. It is very justifiable to assist these men in achieving erectile restoration. In recent years, the widespread use of medications in the treatment of ED has thankfully greatly raised the public's awareness of the issue, as well as the hopes and expectations for regaining sexual abilities. These medications have helped many people restore their sexual function. They are highly effective and have brought many patients to my office to discuss their use. As you know, however, and unfortunately, these medications are not suitable for every patient, leaving some feeling that they may be out of options. For example, men taking nitrates for heart disease should not consider ED medication. In addition, some ED drug treatments, such as sildenafil, do not work for approximately 30% of men. But this isn't the end of the treatment options to restore their sexual function. In my opinion, every man deserves to have all the treatment options discussed with them. When ED medication is not the answer, there are other effective surgical options that can provide a satisfying result. One solution is the penile prosthesis or penile implant, which has been in use for over 40 years and has helped over 300,000 men return to an active, satisfying sex life. Keep an eye out for my 3rd and final video where I'll show you why a penile prosthesis may be the right solution for your patients suffering from ED. And once again, please feel free to contact me with questions or for more information on any topics discussed in this series.